and we'll be ready to go.
Welcome everyone to this live broadcast entitled Fast Facts on the COVID-19 Vax for Kids. My name is Sheila May Young. I'm a family doctor in the city of Kawartha Lakes, and I'm going to be moderating this session that is sponsored by Halliburton Kawartha Pine Ridge District Public Health Unit. Thanks for giving us 1 hour of your very precious time tonight. Our presenters, our expert panel, will be Dr. Natalie Brocking, Dr. Emma Smith, and Ms. Brooke Montney. And they will be introduced separately as they do their presentation. HKPR is situated on traditional territories of the Mississauga and Chippewa nations. This includes the territories of the Treaty 20 and Williams Treaties. We respectfully acknowledge that these nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. We recognize the past harms done on Indigenous peoples and our collective responsibility to right wrongs. We affirm our commitment to building meaningful relationships with Indigenous communities and in improving our understanding of local Indigenous peoples and their culture. We also recognize the unique history, culture, and traditions of the many Indigenous peoples with whom we share this time and space. We give thanks to the Métis, the Inuit, and the many First Nations people for their contributions as we strengthen ties, serve communities, and responsibly honor all our relations. I'm going to introduce our presenters, but before I do that, I want you to note that we have no pharmaceutical grants or funding or affiliations. Let me first introduce our Dr. Natalie Brocking, who is our Medical Officer of Health for HKPR. She is a public health and preventative medicine specialist and was certified by the Royal College of Physicians and Surgeons of Canada in 2015, following the completion of her specialty training at the University of Toronto. Dr. Brocking's academic training also included a medical doctorate from McMaster University and a master's in international public health from the University of Sydney, Australia. Prior to joining HKPR, Dr. Brocking spent 4 years working as a public health physician with Thunder Bay District Health Unit and Sioux Lookout First Nations Health Authority. In her role, she supported the development of a community-based, First Nation-governed public health system for 31 rural and remote First Nations. This included overseeing tuberculosis and hepatitis C programming, population health assessments, and maternal and child health program planning. In addition to her work in public health, Dr. Brocking has worked as a replacement family physician in Northwestern Ontario. She's also published in peer-reviewed scientific journals and presented at provincial and national conferences. Dr. Brocking is going to talk about what COVID-19 looks like in a pediatric population, the importance of vaccination, public health approval process, and where families can go to get their child vaccinated. So let me turn this now over to Dr. Natalie Brocking, who is our first expertise.
Thank you very much, Dr. Young. I'm hoping that everyone can hear me okay. It's a pleasure to join you this evening. And again, thank you for joining and spending a bit of your precious evening time with us, or perhaps streaming at a date and time that also works for you. So as Dr. Young mentioned, I'm going to start just by talking about COVID-19 infection and kids in general. We certainly hear a lot on the media about how COVID-19 infection is not as serious in kids. And we don't hear as much about cases of COVID-19 infection in kids. So to start with, I just wanted to look at some of the data specific to Ontario. And this is data as of November 9th, so already a little bit out of date. So from the start of the pandemic until November 9th, we had in Ontario over 32,000 cases of COVID-19 infection among kids aged 5 to 11. This included 85 hospital admissions, 9 ICU admissions, and unfortunately 1 death associated with COVID-19 infection. This is certainly a smaller number in comparison to older age groups. We do know that COVID-19 infection results in more serious outcomes as you get older. And in particular, we saw really devastating outbreaks and infections among long-term care home residents. However, it's not insignificant among kids. I would note that the case identification, given that it's milder illness among children 5 to 11, there's likely many cases that are not counted here, as many people might not go for testing if they're not feeling sick at all. So we do expect that the total case count for children is underestimated in these figures. When we look at what this means in terms of risk, and we put the numbers together, we see that among this age group specifically, the risk of being admitted to hospital is about 1 in 385 cases of COVID-19 infection. And this is the lab-confirmed COVID-19 infection. And that the risk of being admitted to ICU is about 1 in 3,500 cases. So next slide, please. So I mean, it's a wonderful thing that we don't see as serious outcomes in kids 5 to 11 or in our pediatric population. I do want to bring people's attention to two issues related to more serious outcomes in kids in particular. The first is something that's called multi-system inflammatory syndrome in children. And this is a serious outcome related to COVID-19 infection, in particular impacting children and younger children in this age group. It's a condition that tends to develop after having had an acute infection, with symptoms usually starting approximately 2 to 6 weeks after that initial infection. Although it's a very rare complication, it's a very serious complication. And we know that at least a third of children that are admitted to hospital with this condition ultimately end up in the ICU. And as of June 30th, so this data is a bit out of date, already there had been 42 hospital admissions for multisystem inflammatory syndrome in children, specifically associated with COVID-19 in this age group. The other thing that we really don't know much about is long COVID, and we hear about long COVID symptoms in adults, whether it's persisting fatigue, pain, a multitude of symptoms that really vary by individuals. We do know that there are some children that are impacted by long COVID. There's in particular a clinic that has been started at the Hospital for Sick Children in Toronto. That is seeing an increasing number of referrals for young children that do seem to have symptoms persisting long after their COVID-19 infection resolves. So again, while rare, serious outcomes do happen, unfortunately, in children, and there are some particularly more serious outcomes associated with multisystem inflammatory syndrome in children that we have been on the lookout for. So what about, we've talked a little bit about what infection means in children, but what does transmission mean? So is virus actually passed on from children to either other children or to other age groups? So we do know that school-age children do contribute to the spread of COVID-19, both in schools as well as in household settings or other community settings. We know that the Delta variant is more transmissible, or it spreads more easily from person to person. And the Delta variant is the current variant of COVID-19 that is circulating in Ontario. Greater than 99% of cases are the Delta variant. And there's mixed evidence to say whether or not children actually spread or transmit COVID-19 to a greater degree than adults. I think early in the pandemic, we heard about children being super spreaders. Right now, the evidence is not clear either way, other than to say that we do know that they can transmit infections on, and we certainly do see spread associated with COVID-19 in children. We also know that in schools this year, just in the fall of 2021, that school outbreaks really are disproportionately affecting elementary schools. And this likely is because this age group has not had the opportunity to be vaccinated yet. So we've talked a little bit about some of the physical impacts of COVID-19 on children, but I think many people are well aware of the other collateral harms of the pandemic on children. We can think about the community or societal harms associated with educational losses. We've heard about some of the poor mental health outcomes that have been identified that seem to be increasing among this age group, such as eating disorders, anxiety, depression. We can think about increased sedentary behavior, more screen time, less time being active, and what the long-term implications of that might be in terms of both physical health as well as mental health. There are, and we're continuing to learn more about the variety and I think severity of other social, economic, community-based harms that have impacted children in particular throughout the pandemic. So one of the questions I'm asked a lot is why vaccinate 5 to 11-year-olds if disease is certainly not as severe and risk of severe disease is not as severe? Why should we be vaccinating this age group? And there's a couple of different reasons. So number one is that although the risk of severe outcomes is low and is lower than adults, there is still a risk of severe outcomes. And as we see the overall number of infections increase among 5 to 11-year-olds, whether it be related to school outbreaks, I think it's likely that we'll see more cases of severe illness, even though they're rare outcomes. Vaccination across this age group, I think, will also play a really important role in not only in decreasing the number of infections among 5 to 11-year-olds, which ultimately is going to help prevent disruptions to school and education, as well as other extracurricular activities. We know that disruption to these activities has contributed significantly to some of those other collateral harms of the pandemic that I spoke about before. We also know, because this age group does contribute to spread of COVID-19, that by preventing infection among this age group, we will end up preventing transmission to other members of the community that might be more vulnerable and that might be more susceptible to serious infections or serious outcomes from COVID-19 infection. So I'm going to spend just a couple of minutes or a couple of slides talking about how vaccines are approved in Canada and what that process is like. So ultimately, when scientists are developing a vaccine, they they develop the vaccine, and then they enter into clinical trials once they've seen some success in their initial laboratory-based experiments. So those clinical trials have multiple phases, and then a slowly increasing number of participants in each phase until you reach phase three trials, where there's really enough data, there's enough information on the safety and the efficacy of the vaccine that they might submit an application to whoever the regulating body is that will approve the vaccine for use. That regulating body, which in Canada is an independent body associated with Health Canada, has a team of experts that review all of the safety data, review the efficacy data. They also do a review of the risks versus benefits and determine whether or not it's appropriate for that vaccine to be essentially licensed for use in Canada. From there, we do have ongoing monitoring, which I'll speak about in, I think it's the next slide, please. So after vaccines are approved for use in Canada, and we've received recommendations about their use, how we should see them rolled out throughout provinces, there's an ongoing system of collecting data related to any adverse events associated with vaccines. And really, this reporting system is meant to capture any potential event that happens in accordance with the time frame with vaccines. So you do not need proof that a vaccine has caused a certain event to report it as an adverse event. Everything gets reported into the system. All of the data is collated, and we start to identify, are there themes within this data? Are there any safety signals that are coming up? Next slide, please. So just as a quick summary in terms of where families right now can access vaccine, 3 main routes: health unit-led clinics, primary care-led clinics, and then pharmacies throughout the region all have the pediatric Pfizer vaccine available and are looking forward to seeing families and children soon.
Thanks, Dr. Bocking, for your presentation. At this point in time, we're going to reserve all our questions for the end, and we're now going to move on. And I'm going to introduce to you Dr. Emma Smith. Dr. Smith attended medical school at McMaster University in Hamilton before completing a residency in family medicine at the University of Toronto. She now works as a family physician as part of the Northumberland Family Health Team and provides care to patients in the office and at the Northumberland Hills Hospital. She lives in Cobourg with her husband and her 2 young children. Dr. Smith is going to talk about vaccine safety, how to support children to get a vaccine who may have allergies, side effect management, and what to expect when getting a vaccination at your doctor's office.
Okay, so hi everybody, thanks for tuning in. Excuse me. So I think the biggest concern that's being raised by parents to me in their office is really about safety of these vaccine in our children who are our pride and joy. So that's what I'm here to talk to you about today. So this is the data from the clinical trial that approved the Pfizer vaccine for ages 5 to 11. So as you can see, they included 4,600 children. Approximately 2/3 of those children received the actual vaccine, and the other third were in the placebo group, so they just received saline solution. And they did follow all of these children after their second dose for an average time of 2 months after their second dose. Next slide, please. So I think as a parent, the thing that matters to me the most are, how is my child going to feel after the vaccine, and is anything bad going to happen to them? So you can see all the numbers there, but essentially the take-home message is that after vaccination, children experience many of the same symptoms that you may have experienced after receiving your vaccine, but at slightly different rates. So thankfully, side effects like fever, fatigue, chills, those kind of systemic side effects were actually seen at a lower rate in children. And the only side effect that was seen at a higher rate in children compared to the adolescent cohort was red or sore arm. So they did have a slightly higher rate of red sore arm. I think the other really important thing to note here is that no serious side effects were captured or were noted in this trial, and they were looking very closely. So not only were children monitored physically, looking for objective signs like a measured temperature, parents had to fill in daily diaries, and anything that happened to these children was investigated to see if it might be related to vaccination. So my favorite example is one little guy, 2 days after getting vaccinated, ate a penny. He swallowed a penny. So the investigators actually had to look into, was the swallowing of the penny a vaccine-related side effect? So I really feel confident that no stone was left unturned and there were no serious side effects in this trial. Next slide, please. Oh. So I think the other question that a lot of parents have is about long-term side effects. And the way that I can kind of think about this in my own mind is, I guess, a couple of things. So first, I'd like to point out that mRNA technology has been used in people, in humans, for about 13 years. So we do have long-term data, but it is true that these vaccines themselves are new. So to think about the risk of long-term side effects, I think it's helpful to think about how the vaccines work. So the actual vaccine components that get injected into your arm are gone out of your body within 48 hours using your body's typical waste system, where your body breaks down those molecules and then they're expelled as waste through pee or poop. So after 48 hours, what you're left with is the deactivated spike protein that's created by your body's own tissues using the code from the mRNA. I want to emphasize here that that spike protein is deactivated, meaning it does not have any function other than to trigger your body's immune system. It does not attack other organs in your body, and it cannot invade other cells because it's not an active protein. It just triggers your body's immune system. So within 21 days, that spike protein is actually also gone from your body, and then all you're left with is the protective antibodies that is the point of the vaccine, which give you protection from COVID, the illness, if you happen to be exposed later on. We know that this protection is very effective, about 91% effective in the clinical trial, and we've seen from adults that it is very robust protection for at least 6 months in healthy young people. Another common question I'm getting from parents is about allergies. So I think there are a lot of media reports when the adult vaccines came to market about serious allergic reactions. So ultimately, now that we've done billions of doses worldwide, the estimated risk of anaphylaxis, meaning life-threatening allergic reaction, in the age 12 plus group was about 2 to 8 per million. So it's extremely low. There was no correlation in the adult population with food allergies. So even if your child is allergic to peanuts, I think that they absolutely can be safely vaccinated for COVID-19. And the only allergenic components that would stop a child from being vaccinated were if they have a serious allergy to polyethylene glycol or tromethamine. So what the heck are those things, you might be thinking? Polyethylene glycol is actually super common. It's found in Advil liquid gels. It's found in some formulations of liquid Tylenol. It's found in Restoralax, which is a common laxative that children receive. And again, this would be extremely rare allergy. Tromethamine is a salt that's found in the vaccine vial, and all the tromethamine does is actually keep the molecule stable at fridge temperature, so it doesn't require deep freezing. Tromethamine actually isn't in a lot of substances. The most common place we use it is in a pain medication called Toradol that a lot of pregnant women receive after their C-sections, for example. But again, this would be an extremely rare allergy. So unless you know that your child is allergic to one of those things, there's no cause for alarm. And if a child does have an allergic reaction, we always have all of the tools available to manage that in the clinic. So myocarditis is, I think, the other big thing on parents' minds. So first of all, let's just take a moment to think about what is myocarditis. So myocarditis is a illness that can happen spontaneously or can happen after any vaccination or infection. And basically what it is inflammation of either the coating or the muscle of the heart, which is caused by your body's own immune system. And most patients who experience myocarditis feel either some breathlessness or kind of a pain in their chest. A lot of them do present to the emergency department because it is quite painful. And then there are specific findings that a doctor can see on an EKG or in their blood work that would help to diagnose this. With all cases of myocarditis, most people are just treated with ibuprofen, which is also called Advil, and sent home, and they do really well, and they have no long-lasting side effects. And in general, the risk of myocarditis is highest around age 16, and then goes down the younger that you are. So in terms of COVID and myocarditis, I think much has been made about the risk of COVID vaccines causing myocarditis. So overall, the best statistics we have, and I think it really varies, country to country and how things are tracked, but we think it's on the order of about 37 cases of myocarditis per million doses. So this is an extremely rare side effect, and it is somewhat more common in men than in women. The risk with the COVID vaccine is highest in teenage boys in particular, and then goes down either in older adults or in the children as they get closer to 12. So I think it's very likely, and most experts agree, that the risk in children would be even significantly less than 37 per million. So even more rare than the already very rare risk. And the other thing that I think is really important to note is the risk of developing myocarditis, if you actually catch COVID, the disease, is much higher than the risk of catching myocarditis from the vaccine. And that's true regardless of how old you are. So I think that that's something that we should certainly keep in mind when we're weighing those pros and cons as parents. The other thing is that multisystem inflammatory syndrome that Dr. Bocking spoke about also can cause myocarditis. So I think there's a lot of reasons to not worry so much about myocarditis from the vaccination and think more about how the illness might actually affect your child's heart. And so lastly, I just want to touch quickly on COVID vaccines and your family doctor. So most of you have probably seen some family doctors working in the local mass immunization clinics, and we've all been helping with that effort since the beginning. If you have questions about your child's particular health issues or their safety with regard to the COVID vaccine, or even their history of allergies, that should be your first stop, is to ask your family doctor, if they think it's a good idea for your child to be immunized. A lot of family doctors, at least in Northumberland where I work, are hosting clinics in their office, so you can ask for details. And if you don't have a family doctor and all of your questions are not answered by this presentation, there's a link there for a phone service where you get to speak with a sick kids hospital expert for a booked appointment. You have 40 minutes and you can have all of your questions answered there. And here I've just attached some references just in case anybody wants to do a deeper dive into some of the detailed information that's presented today.
Thanks, Emma, for your presentation. We're now going to move on to our next expert, and that is Brooke Montney. And Brooke is a registered nurse who began her nursing career working on women and children floor at the Belleville General Hospital. Her passion for family health and health promotion led her to her current job as a public health nurse in the Healthy Families Department at HKPR. While working at HKPR, Brooke has taken on many different roles, including organizing and supporting the COVID-19 vaccinations. I'd like Brooke to take it away.
Thank you very much, Dr. Young, and hello, everybody. Just wait for my slide. Perfect. So I'm going to first talk about how to prepare your child for vaccination. So preparing yourself and your child for their COVID-19 vaccination is a very important step. That will help make their experience more comfortable and less stressful. A really great resource I'd encourage you to use is our website at www.hkpr.on.ca. So once you get onto our website, you'll see on the main page at the top, there is a box titled COVID-19 Quick Links. And in that box, you can see another title with a link that's called COVID-19 Vaccines for Children 5 to 11 years. So when you click on that link, it'll take you to a page with lots of great resources and information. That includes a summary of what you need to know about the COVID-19 vaccines, how to book an appointment and our clinic locations, some videos such as Q&As with Dr. Bocking, links to the virtual consult services that Dr. Emma Smith was just speaking about, and also a link to our fact sheet. So here is our fact sheet that you'll be able to find. And I'm just going to go over that with you because, actually, that's not the fact sheet that we have up there. That is a different one, but I'm going to go over what's on that fact sheet that you can find on the website. So the foundation of the fact sheet was based on the CARD system that was developed by Sick Kids Hospital. CARD is an acronym for Comfort, Ask, Relax, and Distract. The card system was originally created to help children and adolescents cope with fears and anxiety during medical procedures such as vaccinations. And it's now being used for children, adolescents, and even adults. And it's being used in any situation where individuals might need to cope with fears and anxiety. So the first step that you can do to prepare your child is to talk about the COVID-19 vaccine. You can talk to your child about why they're getting the vaccine. Some of those reasons might be to keep them healthy and prevent them from getting sick, to prevent their friends and family from getting sick, or to help us return to things we do more safely, such as visiting friends and family or participating in extracurricular activities. You should also talk to your child about what it might feel like when they get their vaccine. So it's important to be honest. You can tell your child that they might feel a pinch or a poke, and encourage your child to ask questions. You can see what information they might already know about the vaccine. And if you don't have the answer to some of the questions, then you can visit our website or gather more information from your family doctor or use the consult services that are available on our website. You can also learn how you can keep your child comfortable during their vaccination. So you should make sure that they wear a short sleeve shirt to the clinic because it'll make the vaccination process much smoother for them. You can talk to your healthcare provider or a pharmacist if you have any questions about pain management. And also, you know your child best. So if there's any other techniques that work well for your child to keep them comfortable, please use them during their vaccination. Understanding how you can help position your child so they can be comfortable to safely receive their vaccination can also be helpful, especially for younger children. So on that fact sheet, there's some steps that can help you figure that out so you can practice. But keep in mind that the staff at the at our clinics are also trained to be able to help position your child safely too. You can also practice modeling ways that you can help your child relax during their vaccination. So a great relaxation technique is breathing exercises. So breathing exercises that encourage your child to take slow, deep breaths. Things that you could do are pretending to blow out candles or pretending that you're blowing bubbles. Some children like to be distracted during their vaccination. So if you think that this would help your child, then you can bring a distraction to the clinic with you. Some items that you could bring include a small handheld toy, music that can be listened to through headphones, or a book. We also do have available at our clinics a distraction handout, an I Spy handout for them if you do forget to bring something. And also keep in mind that some children prefer not to be distracted, and that's totally okay too. All right, so now I'm going to talk about what you can expect at one of our vaccination clinics. So please keep in mind that we do have many different vaccination clinic locations, and each may be set up a little bit differently from another. However, the same general process is followed at each of our clinics. Again, you can either book an appointment at one of our clinics through the provincial booking system, or you can also come walk into the clinic during the clinic's walk-in time. The time for the walk-in period of the clinic is posted on our website. It is preferred, however, that you do book an appointment because it will help decrease the amount of time that you wait in line at the clinic if there is a line. So when you come to our clinic, the first step is screening. So you'll be greeted by a staff member or a volunteer who will go through the standard COVID screening questions with you. And once you've passed the screening, you'll be asked to complete the pre-vaccination questionnaire for your child. You'll be asked to keep the questionnaire with you so that you can give it to the healthcare professional who will be vaccinating your child. Then you'll go to the registration desk where there's a staff member. And at this point, if you feel that your child is very anxious or has a phobia of needles, and you feel they would benefit from being vaccinated in a private area, this is the time when it would be best for you to let the staff member know so that they can arrange for that. Our volunteers and staff are also doing their best to move children and families to the front of lines when there are lines at the clinics, to be able to decrease the waiting time, as we know that this may result in increased anxiety. After registration, you will move to the spot where your child will be vaccinated. So most of our smaller clinics use what we call a stationary model. These models have tables with a healthcare professional and an administrative assistant sitting at them. They're more private. You and your child will sit down at the table with the healthcare professional, and that's where they will receive their vaccination. So again, usually in this area, it's a little bit more private. However, if you do come to one of our clinics that are larger, they might be using the pod model. These clinics have rows of chairs. The healthcare professional and administrative move from chair to vaccinate. So you and your child will sit in one of those chairs to receive their vaccination. The pod model is a little bit less private than the stationary model, but there are several privacy areas available for your child to be vaccinated if needed. So please remember to let the staff member know at the registration desk if you would like to be put in a private area, or if you are already sitting down in the chair at the pod model, you can also let the healthcare professional know at that time. So once your child is with the healthcare professional to be vaccinated, try to remember the items that I just reviewed with you on the fact sheet. If your child has any questions, they may ask the healthcare professional at this time. Position your child in a safe and comfortable position to receive their vaccination. Again, staff working at the clinics are trained to help position your child. Help your child use the relaxation techniques that you have practiced, such as the breathing exercises. And if your child would like to be distracted, they may use the item that they brought with them to distract themselves. And again, as a reminder, we will also have an I Spy handout available for your child to use in case you forgot to bring something. And then finally, once your child has received their vaccination, they will need to stay at the clinic for 15 to 30 minutes to be monitored after they receive their vaccination. A volunteer at the clinic will write down the time that your child must stay until on the sheet of paper, and that paper will include aftercare information. In the stationary pod model, you and your child will move to a chair in the post-vaccination monitoring area and wait there until the end of their monitoring period. And in the pod model, you and your child will remain in the same seat that they were vaccinated in until the end of their monitoring period. And the HKPR staff and community partners and volunteers have been working hard to help create a positive environment for you and your child to receive their COVID-19 vaccine. We continue to implement new interventions and ideas all the time. These include having staff and volunteers from the community who have experience working with clinics being present at our clinics. We have a variety of Band-Aids and stickers for your child to choose from. And we're encouraging our staff to wear things like festive and fun hats. And in fact, this weekend, we're actually having a PJ or onesie weekend theme at our clinics. And at any point, if you need any help or have questions or even suggestions while you're at one of our clinics, then please talk to a volunteer or staff member who will be happy to assist you. All right. Thank you very much.
Thank you, Brooke. And now we have the opportunity for the next 20 minutes or so to ask questions of our expert panel, and they will all come on board and show their faces to you. And we are very blessed to have people submit questions to us prior to this presentation. And so we thank those people who have done so. Our first set of questions is going to be directed to Dr. Emma, and it's from Morgan. What are the most common side effects reported for children receiving the COVID Pfizer vaccination? And are there any rare side effects reported that are of concern? So Emma?
Sure. So we kind of touched on that in the slides. So the most common side effect by far in children was red sore arm that occurred at about a rate of 18.5%. So about 1 in 5 we got a red sore arm. To answer the question about the rare side effects, I just wanted to take a moment to answer something that we haven't addressed, which is fertility. So that's another concern that I think parents want to know about. And just to reassure parents that there is no anticipated risk to fertility in vaccination of children. And there has not been any data to note that fertility is affected by COVID vaccination in adults. So every single pregnancy in Ontario since the beginning of the pandemic and for the last 10 years is tracked in a registry called BORN. And now the vaccination status of all of those patients is also tracked. And there's no evidence that vaccination before, during, regardless of trimester, affects fertility in any way. So just to reassure parents on that fact, because I didn't have time in my presentation to address it. But ultimately, I think the answer is no. There is no anticipated rare side effect. And we are certainly watching closely for myocarditis, which we did see in that older cohort.
So Dr. Natalie, Morgan has a couple of questions for you as well. Are children at risk for the COVID-19 disease or long COVID?
So the answer to both of those questions is yes. Although the risk is lower for children of severe disease and of potentially of long COVID, it's still there, and we still do have some children that have been impacted by serious outcomes, such as multisystem inflammatory syndrome, and including some children impacted by long COVID.
Will the province mandate COVID-19 vaccinations in schools, both the elementary and high school panels?
So I don't know. I don't have a crystal ball. There is in Ontario the Immunization of School Pupils Act, which mandates vaccination for other vaccine preventable diseases like measles, mumps, rubella, tetanus, this sort of thing. I think it's too early right now to be mandating this, but certainly it depends on where the pandemic is heading and what the uptake of vaccination is. Ultimately, the goal is to be protecting kids, schools, communities. So I think lots of things to consider.
And Brooke, Morgan's child has a very special request. Will my child have to remain at the vaccination auditorium 15 minutes after their shot? I ask this because she's not a fan of needles, and when she receives her shot, she wants to get out of there as soon as possible. I understand allergies reaction can be a concern. Do you have an answer, Brooke?
I do. So I completely understand that. However, after your child is vaccinated, they will need to stay at the clinic for 15 minutes if they don't have a risk factor, and 30 minutes if they do have a risk factor, such as having a severe allergic reaction or a history of one. So it is important that she does stay. Keep in mind all the things that I reviewed with the fact sheet, like the distraction. So during that time, you can continue to use the distraction with your daughter. Again, we have the I Spy handout if you're wanting something new for her to use. And again, we have lots of stuff going on at the clinic to try to make that experience more positive for her. So it is important that you do stay for the post-monitoring period.
So again, Dr. Emma, we have Vanessa asking two questions. What if my 11-year-old is 120 pounds and adult size? And what if my 11-year-old turns 12 in February? Do we wait for the appropriate adult dose?
So that's a great question. And as a mother of a 40-pound 2-year-old, I certainly understand the concern. So the answer is that the dose of vaccine is actually based on the patient's age and not at all based on their weight, which is the same reason that myself as an adult is able to receive the same dose as my husband, who's a lot bigger than me, or as, say, my sister, who's a lot smaller than me. So it's based on the maturity level of a person's immune system. So an 11-year-old can receive the 10 micrograms, so the lower dose, regardless of how big and strong they are. The answer about children who are going to turn 12 in between doses, I think truly the scientific answer is it probably doesn't matter which dose that child receives at when they turn 12. A 10 microgram dose would probably be sufficient. It's not as though the day that you turn 12, your immune system shifts, and it's just the way that the vaccines were studied. So I think, and Dr. Bocking can correct me if I'm wrong, I think the current guidance is to get the vaccine as soon as you are eligible. So I would get my 120-pound 11-year-old his lower dose vaccine right now because that's based on his actual age. And then if he's already 12 by the time his second dose rolls around, which is going to happen for some kids, then he could have the 30 microgram adult dose. I think in some jurisdictions they are also offering the option of a second dose of the same lower dose, but I think in terms of efficacy and safety, the risks are basically the same. So it really doesn't matter.
So Dr. Natalie, the National Advisory Committee on Immunization, which we shorten down to NACI, is based in science and recommends that 8 to 12 weeks is the interval between doses, with 12 weeks the preferred. But Health Canada has approved 3 weeks. How do we know what's best?
So it's an interesting question. When Health Canada approved vaccines for use based on the clinical trial data, its safety, its efficacy. So the product Monograph, or the manufacturer of the Pfizer pediatric vaccine, has demonstrated the data that with 3 weeks in between the first and the second dose, you do get an immune response. It is safe and it's effective. What happens after Health Canada approves it is NACI then is also looking at all of that same data, as well as further additional population-based studies. And through some of the other reviews, they've determined, well, if you actually wait a little bit longer, you seem to get an even better immune response than if you waited for that 3-week interval in between. And that's why at this point in time, NACI is recommended for children, the 5 to 11-year-old age group, for 8 weeks to be in between. Certainly 3 weeks is still effective, but we want to be getting the best immune response that we can from these vaccines.
So Kristen has addressed this question to Dr. Natalie as well. It's a little bit similar to what Vanessa had asked. My child is turning 12 in April 2022, and we are in a low exposure situation. Will she be eligible for the adult Pfizer dose as of January the 1st, 2022? And would the benefit of a higher dose be worth the wait?
So my answer is similar to what Dr. Smith was, is that really I think the vaccine that is available now and that they're eligible for is the right vaccine dose to take. Certainly the 10 microgram dose for an 11-year-old will get a good immune response. And I think what we're seeing right now is that it doesn't take very long for a low exposure setting to see a fairly rapid increase in cases. So, I mean, just across HK care jurisdiction over the last week, our incidence rate has doubled. So things can change quickly, and with new variants that are emerging, I think it's prudent and to access the vaccine that's available now.
And Mike has another question for you, Dr. Natalie. If the latest variant out of South Africa becomes the dominant variant in Canada, is there a chance that the current vaccination for children would be ineffective and that there would be a new one for the new strain?
So there's always a chance, although I think the key is that it's unlikely that it would be totally ineffective. I think you would still see some response against a new variant. The vaccines that are currently approved now have demonstrated effectiveness against a number of different types of variants. The new Omicron variant has mutations that are similar to some of these other variants. So I think we can expect there will still be some immune response. We just don't know yet how extensive that will be.
And Dr. Emma, Mike has a couple of questions for you as well. Of the 3 million kids vaccinated in the United States, has there been serious side effects or fatalities? And has there been any research or other assurance that the current vaccination for children could impact long-term development of a child's organ, reproductive systems, etc.?
Sure. So to answer the first question, I actually just looked it up because the data is changing all the time. So there's actually been 4.5 million doses administered to children aged 5 to 11 in the States. So in a way, we're lucky because they got out ahead of us and they have such a large population that it's, we're going to have a lot of data. So the way that vaccine adverse events are reported in the States is very similar to Canada, where there is a adverse events reporting system. So anything that occurs on a timeline that relates to the vaccine is reported through that system. And then an investigation is undertaken to look into whether that thing that occurred actually related to the vaccine. So did the child swallow the penny because they got vaccinated, or did they just swallow a penny because they were sick? In the case of the CDC data, they have not formally published any of that data yet, but it is being closely monitored. And I think it's worth noting that there hasn't been any media reporting yet of any adverse event from those vaccinations. And this is essentially the most scrutinized pharmaceutical product in history. Everybody's got their eyes on it. So although there is no formally published data yet on those children, it is being actively looked at. And I suspect we would have heard if there were side effects. To answer the other question in terms of long-term effects, I think that goes back to the mechanics of how the vaccine actually works in your body. So again, just to emphasize that the spike protein is gone from your body within 21 days of receipt of the vaccine. And we looked at all of the children who received the vaccine, for on average about 2 months after their second dose. So those kind of short-term side effects, I think, are adequately investigated. And the long-term side effects are not really anticipated because the vaccine itself is gone. And all you're left with is your body's natural response to prevent COVID infection. I think it's also worth noting that no vaccine in history has caused a documented long-term side effect beyond 8 weeks, with the exception of the varicella vaccine, which is chickenpox, which can cause adults to get shingles later in life, but at a much lower rate than actually catching the chickenpox would. So, again, it's extremely unlikely that these vaccines would have any sort of long-term side effect. And certainly if the antibodies to COVID are what are going to cause a long-term side effect, then catching COVID would have that same risk. So that's what makes me feel confident, in terms of encouraging my patients to be immunized.
And again, Dr. Natalie, we have a question for you from Mike. If an unvaccinated child under 12 gets COVID, the disease, what are the current range of outcomes? That is, how sick are they going to get? And once vaccinated, what is the expected range of outcomes? How sick might they still get?
So if a child under 12 that is not vaccinated gets COVID, there's a wide range of symptoms and illness, anywhere from having very mild symptoms to having very severe infection, needing to be admitted to hospital, likely with breathing difficulties or other organ difficulties, and ultimately sometimes ICU admissions associated with that on the extreme end. We talked a little bit already about some of the other complications, such as multi-system inflammatory syndrome, that are also, while rare, still seen among children that have COVID-19 infections. There's not a lot of data right now on what COVID-19 infection would look like in a child that has been vaccinated. What we do know among older age groups is that if people get COVID-19 after being vaccinated, they get much milder illness. So it's still very good at preventing severe illness from COVID-19. And what we're seeing in our current data with the adult population is that those people that are getting more serious illness from COVID-19 after being fully vaccinated tend to be much older and tend to have other medical problems that might already impact their immune system.
And Nurse Brooke, my youngest daughter was born in 2017. Come January the 1st, 2022, will she be eligible to get her first COVID vaccination? Or will she have to wait until she turns 5 during that year? This is from Gemma.
So right now, the ministry is allowing any child who will be 5 by December 31st of 2021 to receive their COVID vaccine. So we're still waiting to hear, though, from the ministry about the specific eligibility criteria for children who will be turning 5 in 2022, such as your daughter. So like if they will need to wait right until their birthday or not. But we will be sure to notify the community once we hear anything from the ministry. So stay tuned for that update.
And panel, this is probably will be one of our final questions. And Dr. Natalie, if you would answer this question, would you have these injection clinics at the schools? And if so, will you give notice to the parents beforehand? Will you and the staff listen to the children if they do not feel comfortable and not consent?
So at this point in time, we don't have any clinics scheduled during school hours at a school. We do have some clinics that are being held at area high schools on the weekend, but not at elementary schools. If we do host a clinic at a school, there will be lots of notice given to parents because we expect parents to come and accompany their children, and we expect their consent to be provided for children to be vaccinated. So children between the ages of 5 to 11 won't be vaccinated without their parents' consent. And certainly, if the parent is there, the child is there, and they're expressing that they're not comfortable with this isn't something that we would continue with. I think all of our staff, all of the volunteers we're there to support families and children, and we know these are challenging decisions, but no child is going to be vaccinated without their parental awareness and parental consent.
And Dr. Emma, do children have natural immunity to this virus?
I think the short answer is no. So a child who has not previously been exposed to COVID-19 does not have any baseline immunity to that virus. And the vast majority of children in Northumberland, thankfully, have not yet been exposed to COVID because we have just been so lucky in Northumberland and Kawartha Pine Ridge and the entire HKPR region to have had low rates throughout this pandemic. So the short answer is no, your child does not have natural immunity to COVID.
So both of Dr. Natalie and Dr. Emma, this person wants to know, do you have children and do you feel comfortable having them vaccinated? So maybe Natalie can go first, and then Emma has already told us about her kids.
Sure. So I have 2 children, one of whom is now eligible in that age group between 5 to 11, and they have already received their first dose. I didn't quite make it onto the booking system right when it opened, but within kind of an hour or so, I was on there booking their appointment. And I would just comment to say that I'm the type of parent that doesn't typically seek medication. We avoid antibiotics at all costs. We really don't tend to medicate if we really don't have to. But vaccination to prevent illness is, I think, a really, really key step.
And I would just add that my daughter is 4. As soon as she's 5, we will absolutely be accessing vaccine for her, or hopefully in January before her birthday if the ministry says that's allowed.
So we've come to the end of our allotted time for this Fast Facts for Kids live broadcast. I would like to express my sincere appreciation for our expert panel, Dr. Natalie and Dr. Emma, and our public health nurse, Brooke. Most importantly, I would like to thank all the attendees and especially the question submitters. This broadcast was recorded and will be available to review on the HKPR website in due course. So thank you again and good night to all.